My name is Devondre Purcell, and today I'm going to be showing you how to insert an indwelling catheter into a male patient. Before going to the room, I check the patient's order to make sure that there's no obstruction that will hinder the procedure from happening. I did my hand hygiene, ensured privacy, and also I greeted the patient and identified the patient with 2 patient identifiers. I made the patient aware of the physician orders and I explained the procedure to him, telling him that he's going to have an indwelling catheter go into his urethra to help him avoid urine out. After that, I did an inspection. I palpated his lower abdomen, and after that, I washed up my hands. I got my supplies ready, and now we're about to start the procedure. But I messed up the first time. The box got messed up and I didn't have the paper or the sterile gloves, so I got gloves from my job and I had to put it in the computer paper to mimic the sterile paper. I hope that's fine. So I'm gonna begin now. Now I'm gonna begin my procedure in inserting my indwelling catheter into my male patient. What you want to do, you want to start off by opening the outer wrapper by touching its corners or the 1-inch border that's considered non-sterile. The edges. Okay. Again, I messed up my box, the wrapper that the sterile gloves came in. I don't have sterile gloves, so I made a makeshift one. So what I'm gonna do first is I'm gonna grab my sterile gloves, and I'm gonna open it by its 1-inch border that's considered non-sterile. Again, grabbing the 1-inch border that's considered non-sterile. I'm gonna use my non-dominant hand and grab the glove of my dominant hand by the 3 fingers and by the cup, so I'm not touching the sterile part of the glove. And I'm going to slide my dominant hand into the glove. Make sure my skin does not touch the sterile part. Now with my sterile glove, I'm going to grab the inside cuff of the non-dominant hand glove, and I'm going to slide my non-dominant hand into the glove. Again, making sure the sterile parts of the glove do not touch my skin. And since these gloves are sterile, I'm going to be able to fit it on properly. This paper I'm going to keep here to be able to discard it. Next, let me just move this out the way. Next, I'm going to drape my patient, grabbing the edges, making sure that I keep my drape sterile. So I'm going to open it, making sure that it doesn't touch anywhere, shiny side down. I'm going to put over my patient's thighs, over the penis, making sure the opening is right over the penis. Next, I'm going to, if I had the tray, I would have took the tray out, but now since I don't have the tray, I'm going to lubricate my catheter on this end, and also I'm going to put my iodine solution putting my iodine solution onto the cotton balls on this end. But before I do that, I'm going to connect my syringe to my catheter, so when it's time to inflate, I don't have to do it afterwards. I'm going to open up the water-based lubricant to mimicking opening it and pouring it right here. Then I'm going to put my catheter into the lubricant and allow it to sit there until I'm ready to insert it into the patient. Next, I'm going to take my iodine solution. I'm going to pour it over my cotton balls. Now that those are done, what I do next is I grab the patient's penis. 1 second. Not using my elbows, hands is up. I'm just gonna have you see it. Yeah, there we go. I'm gonna hold the penis with my non-dominant hand, grab my tongs with my dominant hand, and begin to clean the urinary meatus, going from in, making circular motions, do 3 swipes, drop it in the garbage, use a Newcomb bulb for each one, throw it in the garbage, last one, there we go. Now, my indwelling catheter, I found the urinary meatus while I was cleaning this, so now I'm gonna insert it into, keeping the penis a little, I'm gonna tilt it up a little bit so I can be able to push it in. And what I'm gonna do, if I feel any resistance or if I'm feeling a blockage, I'm not gonna push, but everything is fine. And I'm gonna keep going until I see urine. And now that I see urine, I'm going to advance just a little bit further. And then I'm going to inflate the balloon that's in the urinary catheter. Now that that's inflated, I'm gonna pull back so I can feel the resistance, in which I do. Okay. So now, since I'm by myself, Mr. Jones, I'm gonna go take these gloves off, wash my hands, and then I'm going to attach the catheter to your leg so that it doesn't get caught up if you're moving around or anything. I take off my sterile gloves, grab the middle of the palm, and these gloves are small. Pull it off, ball it up. Now put my fingers inside of the glove, so I'm not touching the sterile. Well, it's not sterile anymore. And I pull it over, ball it up. I'm gonna do it this, and throw this in the garbage. Then my hand hygiene, and I'm gonna put on a pair of clean gloves. I'm putting on these clean gloves, so now I could attach the catheter to the strap, I forget his name, to the patient's thigh. But first, I'm going to, before attaching it, I'm going to clean the patient's thigh with alcohol. I'm gonna put the device on, then I'm gonna attach the catheter onto there. And after that, I'm gonna put the catheter bag on the bed frame, not the bedside rails or any movable part of the bed. Okay. And now that's there. We're gonna act like it's hanging there. I'm able now to clean my workstation. All of my supplies. Sorry about that. All of my supplies. And I'm gonna toss it into the garbage right here. And then after that, I'm going to again take off my gloves, do hand hygiene. Okay, Mr. Jones, now that you have a catheter in you, there's certain things that we wouldn't want you to do, like we wouldn't want you to pull on it because it can cause bleeding. Also, you don't have to worry about getting up and going to use the bathroom or anything like that because this will do it for you. If you have any questions, you could just call me. I'm right outside, or your call bell is right in your reach. After I discuss that with the patient, I'm gonna have the teach back methods. I'm gonna ask the patient to honestly repeat what I said or tell me in his own words what he should do with the catheter. And after that, I'm gonna document the procedure, how well the patient tolerated it, if there were anything went wrong, and then I'm done.